Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
Which assessment data would indicate to the nurse that the client would be at risk for a hemorrhagic stroke? 1. A blood glucose level of 480 milligrams per deciliter. 2. A right-sided carotid brute. 3. A blood pressure of 220 over 120. 4. The presence of bronchogenic carcinoma. The correct answer is 3. A blood pressure of 220 over 120. Uncontrolled hypertension is a risk factor for hemorrhagic stroke, which is a ruptured blood vessel inside the cranium. At 8 a.m., the nurse reviews the amount of T-tube drainage for a client who underwent an open cholecystectomy yesterday. After reviewing the output record, the nurse should 1. Report the 24-hour drainage amount at 12 noon. 2. Clamp the T-tube. 3. Evaluate the tube for patency. 4. Irrigate the T-tube. The correct answer is 3. Evaluate the tube for patency. The T-tube should drain approximately 300 to 500 ml in the first 24 hours, and after 3 to 4 days, the amount should decrease to less than 200 ml in 24 hours. With the sudden decrease in drainage at 8 a.m., the nurse should immediately assess the tube for obstruction of flow that can be caused by kinks in the tube or the client lying on the tube. Drainage color must also be assessed for signs of bleeding. The tube should not be irrigated or clamped without a prescription.
A nurse teaches a client experiencing heartburn to take 1.5 ounces of Maalox when symptoms appear. How many milliliters should the client take? Blank ml. The correct answer is 45 milliliters. 1 ounce equal to 30 milliliters. You multiply 30 by 1.5. You get 45 milliliters. A client's diagnosis of cystic fibrosis was made 13 years ago, and she has since been hospitalized several times. On the latest admission, the client has labored respirations, fatigue, malnutrition, and failure to thrive. Which nursing actions are most important initially? 1. Placing the client on bed rest and prescribing a blood gas analysis. 2. Prescribing a high-calorie, high-protein, low-fat, vitamin-enriched diet and pancreatic granules. 3. Applying an oximeter and initiating respiratory therapy. 4. Inserting an IV line and initiating antibiotic therapy. The correct answer is 3. Clients with cystic fibrosis commonly die from respiratory problems. The mucus in the lungs is tenacious and difficult to expel, leading to lung infections and interference with oxygen and carbon dioxide exchange. The client will likely need supplemental oxygen and respiratory treatments to maintain adequate gas exchange, as identified by the oximeter reading. The child will be on bed rest due to respiratory distress. However, although blood gases will probably be prescribed, the oximeter readings will be used to determine oxygen deficit and are, therefore, more of a priority. A diet high in calories, proteins, and vitamins with pancreatic granules added to all foods ingested will increase nutrient absorption and help the malnutrition. However, this intervention is not the priority at this time. Inserting an IV to administer antibiotics is important and can be done after ensuring adequate respiratory function. A client who has been given cardiopulmonary resuscitation is transported by ambulance to the hospital's emergency department, where the admitting nurse quickly assesses the client's condition. The most effective way to determine the effectiveness of CPR is noting whether the 1. Pulse rate is normal. 2. Pupils are reacting to light. 3. Mucous membranes are pink. 4. Systolic blood pressure is at least 80. The correct answer is 2. Pupillary reaction is the best indication of whether oxygenated blood has been reaching the client's brain. Pupils that remain widely dilated and do not react to light probably indicate that serious brain damage has occurred. The pulse rate may be normal, mucous membranes may still be pink, and systolic blood pressure may be 80 or higher, and serious brain damage may still have occurred.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is given amiodarone in the emergency department for a dysrhythmia. Which of the following indicates the drug is having the desired effect? 1. The ventricular rate is increasing. 2. The absent pulse is now palpable. 3. The number of premature ventricular contractions is decreasing. 4. The fine ventricular fibrillation changes to coarse ventricular fibrillation. The correct answer is 3. Amiodarone is used for the treatment of premature ventricular contractions, ventricular tachycardia with a pulse, atrial fibrillation, and atrial flutter. Amiodarone is not used as initial therapy for a pulseless dysrhythmia. During cardiopulmonary resuscitation, the xiphoid process at the lower end of the sternum should not be compressed when performing cardiac compressions. Which of the following organs will be most likely at risk for laceration by forceful compressions over the xiphoid process? 1. Lung. 2. Liver. 3. Stomach. 4. Diaphragm. The correct answer is 2. Because of its location near the xiphoid process, the liver is the organ most easily damaged from pressure exerted over the xiphoid process. During CPR, the pressure on the victim's chest wall should be sufficient to compress the heart, but not so great as to damage internal organs. Injury may result, however, even when CPR is performed properly. When performing external chest compressions on an adult during cardiopulmonary resuscitation, the rescuer should depress the sternum. 1. 0.5 inch. 2. 1 inch. 3. 1.5 inches. 4. 2 inches. The correct answer is 4. An adult sternum must be depressed 2 inches with each compression to ensure adequate heart compression. If a client is receiving rescue breaths and the chest wall fails to rise during cardiopulmonary resuscitation, the rescuer should first: 1. Try using a bag mask device. 2. Decrease the rate of compressions. 3. Intubate the client. 4. Reposition the airway. The correct answer is 4. If the chest wall is not rising with rescue breaths, the head should be repositioned first to ensure that the airway is adequately opened. A bag mask device allows for delivery of 100% oxygen, but is difficult to manage. If there is just one rescuer, ideally 2 persons are used to operate the bag mask device, one to maintain the seal and the other to provide the ventilations. Compression should be maintained at 100 per minute.
When discussing recent onset of feelings of sadness and depression in a client with hypothyroidism, the nurse should inform the client that these feelings are: 1. The effects of thyroid hormone replacement therapy will diminish over time. 2. Related to thyroid hormone replacement therapy and will not diminish over time. 3. A normal part of having a chronic illness. 4. Most likely related to low thyroid hormone levels and will improve with treatment. The correct answer is 4. Most likely related to low thyroid hormone levels and will improve with treatment. Hypothyroidism may contribute to sadness and depression. It is good practice for clients with newly diagnosed depression to be monitored for hypothyroidism by checking serum thyroid hormone and thyroid-stimulating hormone levels. This client needs to know that these feelings may be related to her low thyroid hormone levels and may improve with treatment. Replacement therapy does not cause depression. Depression may accompany chronic illness, but it is not normal. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The rapid response team has been called to manage an unwitnessed cardiac arrest in a client's hospital room. The estimated maximum time a person can be without cardiopulmonary function and still not experience permanent brain damage is: 1 to 2 minutes, 2 4 to 6 minutes, 3 8 to 10 minutes, 4 12 to 15 minutes. The correct answer is 2. After a person is without cardiopulmonary function for 4 to 6 minutes, permanent brain damage is almost certain. To prevent permanent brain damage, it is important to begin CPR promptly after a cardiopulmonary arrest. A nurse is helping a suspected choking victim. The nurse should perform the Heimlich maneuver when the victim 1. Starts to become cyanotic, 2. Cannot speak due to airway obstruction, 3. Can make only minimal vocal noises, 4. Is coughing vigorously. The correct answer is 2. The Heimlich maneuver should be administered only to a victim who cannot make any sounds due to airway obstruction. If the victim can whisper words or cough, some air exchange is occurring, an emergency medical system should be called instead of attempting the Heimlich maneuver. Cyanosis may accompany or follow choking. However, the Heimlich maneuver should only be initiated when the victim cannot speak. When performing the Heimlich maneuver on a conscious adult victim, the rescuer delivers inward and upward thrusts specifically. 1. Above the umbilicus. 2. At the level of the xiphoid process. 3. Over the victim's mid-abdominal area. 4. Below the xiphoid process and above the umbilicus. The correct answer is 4. The thrust should be delivered below the xiphoid process, but above the umbilicus, to minimize the risk of internal injuries.
A client with acute pancreatitis has a blood pressure of 88/40, heart rate of 128 beats per minute, respirations of 28 breaths per minute, and Gray-Turner's sign. What action should the nurse perform first? 1. Assess the urine output. 2. Place an intravenous line. 3. Position on the left side. 4. Insert a nasogastric tube. The correct answer is 2. Place an intravenous line. Gray-Turner's sign is a bluish discoloration in the flank area caused by retroperitoneal bleeding. The vital signs are showing hemodynamic instability. IV access should be obtained to provide immediate volume replacement. The urine output will provide information on the fluid status. A nasogastric tube is indicated for clients with uncontrolled nausea and vomiting or gastric distension. Repositioning the client may be considered for pain management once the client's vital signs are stable.
The nurse is preparing to defibrillate a client on a cardiac monitor who is in ventricular fibrillation. See the photo. The nurse should do which of the following? 1. Move the paddle in the nurse's left hand to the midline. 2. Move the paddle in the nurse's right hand to above the client's nipple. 3. Grasp the handles of the paddles to allow visibility of the black markings on the paddle. 4. After pressing the charge button and calling all clear, push the shock button. The correct answer is 4. The paddles are in the correct position. The nurse can push the shock button to defibrillate the client.
You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanursiguide.com.